Hello, everyone. Welcome to tonight's episode of Navigator Nuggets. I am your host, Dr. Nicole Rochester. I am a board-certified pediatrician, a former caregiver to my dad, an independent health advocate, and the CEO of Your GPS Doc. And every Monday night at 8 o'clock p.m. Eastern Standard Time, right here on this Facebook page, we do Navigator Nuggets. And this is my way of giving back to the community. This is my way of really giving information and insight and tips to individuals in terms of how to appropriately and effectively navigate the healthcare system. So as you all know, we have been talking all about coronavirus really since March. Since the first Monday in March, every single episode of Navigator Nuggets has been dedicated to the coronavirus pandemic. And tonight, I really wanted to focus on health disparities. So, as you all know, if you've been watching the news or if you've been on social media over, I would say, the last 3 to 4 days, you have seen the reports that have talked about just the tremendous health disparities that we are seeing with COVID-19 as it relates to communities of color, and specifically as it relates to the African American community. The presence of health disparities in the United States is long. It's been going on for a long time. And, like I said, to many of us in the inner circle, so to speak, this was not a surprise. And in fact, many of us kind of dreaded the statistics that have recently been reported when it comes to coronavirus and the fact that African Americans and people of color are being disproportionately impacted. I want to start out just by providing a little bit of background to those of you who may, if this is a new concept to you. But again, really, when we say health disparities, what we are talking about is a difference in health outcomes. We're talking about a difference in the health care, the quality of health care that individuals receive. Okay. And so when we talk about disparities, we're talking about differences in health outcomes among a particular group, whether you're talking about, in this case, people of color, or in, gay, bisexual, lesbian population. And these things are not just explainable by biology. And this is what's really, really important, because I mentioned a few minutes ago when I was in medical school, I will never forget that we would have these lectures where these, generally white professors would come in and talk about diabetes and high blood pressure and, heart disease, and how Black people had 2 times this and 3 times that. And there was this implication that somehow people of color were, genetically inferior, or they would blame it on, they just don't take care of themselves, or poor diet and things of that nature. And, unfortunately back then they weren't discussing what we now know is the result of really structural and systemic racism and inequality. And this goes down, this is far reaching. Like, I could not even begin to touch the surface of it tonight, but just understand that it is rooted in our policies. It is rooted in our laws, and those have trickled down to impact the health and the health care that communities of color receive. So another important topic is when we talk about equity versus equality. Equality basically means everybody getting the same thing, okay? Whereas equity really refers to giving people what they need to achieve their best health. And so there are several images that have been widely circulated to demonstrate or illustrate this fact. But the one that I like the most, and the one that I wanted to share with you all tonight, basically has like a tree. Just picture like a fruit tree, and picture a really tall man, and then picture like a medium, average height woman, and then picture a small child. Okay. So health equality would basically be all 3 of those people are standing at the same height. And so in that example, the tall man is going to have easy access to that fruit, right? He's going to be able to grab that fruit, put it in his basket, take it home. The woman of average height is going to be reaching, but no matter how far she jumps, no matter what she tries to do, she's not going to be able to reach that fruit on that tree. And of course, the small child has no chance, right, of being able to reach that tree that's, feet above his arm span. And then think about health equity. Health equity in that same image shows differing heights of like a step stool, as an example, or a box that you would stand on. And so the tall guy, because he can just reach his arm up and grab the fruit, really doesn't need a step stool, right? So maybe he's just standing on the ground. And then that average height woman is given a stool that puts her at the exact same height as the man. And then that kid maybe has to stand on 3 boxes or a really tall ladder in order to reach that same height. And so that's health equity, where everybody has an equal chance of receiving appropriate and effective health care. And the key with that image is that there are things that we as a society have to do in order to get everybody on a level playing field, because we are not on a level playing field and we cannot continue to blame the victim. So just as an example, when you blame the high rate of obesity among African Americans on the African Americans, and when you say, oh, well, that's because you all eat too much salt, or you all eat too much fried foods, or, well, have you all ever driven through, the hood? Have you ever driven through an impoverished neighborhood in an African American area, like in a city, in an urban area? And they don't have, in my neighborhood, you guys, we have, I can probably name at least 5 or 6 really nice grocery stores that I can get to in my car within less than 10 minutes. That's not the case in many of our impoverished minority neighborhoods. They may have a corner store only with, junk food, and they may not have access to a real grocery store. So that's just one example where, we have what are called food deserts, where there are some communities where they don't even have access to appropriate healthy foods. They don't have access to green areas and parks, or it's not safe for them to play outside, but yet we blame them for not getting adequate exercise. Or they are in neighborhoods where intentionally, by design, there is a lot of pollution. And so as a result of that, they have disproportionate rates of asthma. Okay, so are you starting to follow me here? So if you don't have access to the ideal conditions that allow you to be your healthiest self, then you are going to suffer at disproportionate rates from diabetes, from obesity, from heart disease, and from asthma. And why am I talking about that tonight in the midst of a coronavirus pandemic? Because that is the key behind this data that is finally starting to come out that shows that African Americans and Latinos and other communities of color are being disproportionately impacted by COVID-19. Not only are I'm including myself in that number, not only are communities of color being infected at higher rates, but they represent the vast majority of the deaths that we are seeing from COVID-19. So just to share some of the statistics. So in the state of Michigan, African Americans make up 14% of that population, but they represent 41% of the deaths so far due to COVID-19. In the city of Chicago, African Americans make up 30% of the population, but they make up 68% of the deaths from COVID-19. In Louisiana, African Americans represent 32% of the population, but 70% of the deaths. And we have seen similar numbers in North Carolina, South Carolina, New York. And I'm sure as the coronavirus continues to make its way across the country, we are going to continue to see these disparities in the deaths and in the positive cases among communities of color. This is absolutely unacceptable. And as I've stated, this is due to disparities in income. We also know that minorities, particularly African Americans, are more heavily represented in the essential workforce. So your public transportation, your grocery store workers, your factory workers, they are often on the front lines. And when I say front lines, I'm not necessarily talking about healthcare, but I'm talking about these essential employees. They are more likely to be employed in the industries that have that are continuing to serve us, okay? The Postal Service is another example. So as a result of that, we are seeing increased cases among communities of color. We are seeing increased deaths among communities of color. And what I am here to talk about tonight is that what can we do about it? What can we do about that? Obviously, we are not going to fix years and years and years of systemic racism, of discriminatory policies and laws and things like that. We're not going to fix that right now, and we're certainly not going to fix that in the midst of a global, global health emergency. But what I am here to do today is to share with you all some things that you can do to help combat these health disparities that I've talked about. Because what I've talked about so far is the underlying kind of systemic problems that have led to health disparities that we are seeing with coronavirus. And again, this is way bigger than coronavirus. The coronavirus has just shed a light on the disparities that already existed. But something that I have not yet talked about is bias. And so what I know for sure, and what many of my colleagues know for sure in medicine, is that there is bias in the healthcare industry, okay? And so that bias, on top of all of the things that I've already talked about, is absolutely playing a role in why we are seeing more devastating impact of coronavirus among people of color. So what do I mean when I say bias? Just what you think. Basically, people of color do not receive the same care in healthcare settings as Caucasians, okay? That is a fact. It has been studied. It pains me to say it. I've talked about this on previous episodes of Navigator Nuggets. Just as an example, they have done studies looking at the administration of pain medication in emergency rooms, okay? And they have shown that when you have the same presentation, let's say you have two people who go with pain from kidney stones, or two people, or not, maybe, the studies obviously have more than two people, but two people who present with appendicitis, and the only difference in their presentation really is their race. You may have a black man and a white man. That studies have shown that individuals of color do not get pain medication prescribed at the same frequency that Caucasians do. And guys, this even trickles down to pediatrics. There have been studies in pediatrics, the kids who have gone to the ER with appendicitis, meaning they have had some type of scan that has shown that they actually have a medical problem for their belly pain, okay? And in kids with diagnosed appendicitis, the black kids did not get the same degree of pain treatment as the white kids. So when I'm telling you that we receive different care, individuals of color receive different care, I am telling you that it is the absolute truth, and it has been studied. We also have seen this with cancer therapy. We've seen this with heart surgery. Aggressive options, therapeutic options for cancer are not offered as frequently to African Americans, to Latinos, as they are to the majority, to Caucasians, okay? This is incredibly important as we begin to talk about coronavirus. Why? Because some of the disparities in coronavirus that we've already seen have to do with testing. So we know already that the areas that have been designated as testing sites, the areas where they have, quickly put up some of these drive-through testing sites, they are disproportionately located in the wealthier communities, in the more affluent communities. And so we know that in the communities of color, they don't have the same access to coronavirus testing. This is a fact. Not only that, okay, you have drive-through testing. That assumes that everybody has a car. So, I mean, again, when you really start to think about it and analyze it, if the only access that I have, within 30 miles of my home is a drive-through test, and I don't own a car, how do I do that? The Metro bus, I live in the DC area, we call it Metro. The Metro bus is not going through the drive-through testing site. So just in the very nature of the policies that are guiding the testing, those are flawed and those are skewed towards the majority community. And so I also have heard from emergency room colleagues of mine that individuals of color are not being tested. So they are presenting to the ER with the same symptoms that everybody else with coronavirus is presenting with: fever, cough, shortness of breath. And guess what? They are not being tested. Many of them are not being tested for coronavirus. They are being sent home with inhalers, maybe an antibiotic, maybe not. Some of them are not getting chest x-rays. I have a colleague who has told me that she has people calling her up, and she heard from an African-American gentleman who went 3 times to his local ER with fever, cough, shortness of breath, was not tested. He's frantically trying to find out, how can I get a coronavirus test? This is 2020, okay? And this is happening. So the reason that I wanted to focus my episode of Navigator Nuggets tonight on health disparities is that, you all need to understand that if you are a person of color, you are going up against all kinds of barriers, mostly invisible, that may prohibit or at least make it difficult for you to get the care that you need. And so I'm going to share just a few things that you can do to basically help to try to level that playing field. The other thing we know is that if there is a delay in testing, if there is a delay in diagnosis, then you are going to be more likely to have a bad outcome. So if individuals of color are being turned away, if they're being sent home, more likely told to watch your symptoms, then they are going to be disproportionately affected. They are going to have more complications. Some of them are going to die in their homes because they were not hospitalized when they should have been, because they were not started on some of the therapies that can help mitigate the impact of coronavirus. Another thing you need to know is that, going back to the testing, a lot of the sites, including here in the state of Maryland, a lot of the protocols and the guidelines that are coming down by the CDC that are informing our doctors, our nurses, our healthcare facilities, those protocols basically start with, you need an order from your physician to get a coronavirus test. Now, obviously, if you present to the ER or to an urgent care center, that's a different story. But what are they telling us? What is the message? The message is to stay home. The message is that if you have mild symptoms, call your PCP, your primary care provider. Well, again, going back to health disparities, we know that individuals of color are less likely to have health insurance. They are less likely to have a regular health care provider, a primary care provider, even if they have health insurance. So again, there's a disparity here where you have individuals who are having symptoms, they're watching the news, they're on Facebook, they're on Twitter, they know what the signs and symptoms of coronavirus are, but they don't have a primary care doctor. So they can't just pick up the phone and call somebody to get that order. I can use myself as an example, just as somebody of color with privilege. So my husband and I have a new health insurance plan. We switched health insurance companies in February. And guess what? The doctor that we used to have is no longer taking new patients right now. So I don't even have a PCP right now, but I am a physician. I'm an independent health advocate. I know how to navigate the system. So the other day when I was having some concerns about my own health, I went and got my health insurance card. I went online. I went to the website. I was able to find information about how to schedule a video visit. So then I went and scheduled the video visit on my laptop, and then I was able to download the free app on my smartphone. And within 40 minutes, I was looking at a doctor who I had never met on a video call through my new health insurance. She was able to talk with me, find out what my symptoms were, determine that I really didn't need to be tested for coronavirus at that time. But guess what, you all? Because I'm a doctor, which I did share with her, she was like, well, I'm going to go ahead and give you the test order anyway, just in case you decide that you want to get the test. That's privilege, you all. That is privilege because of my education, because of my background, because I'm a physician, because I'm an independent health advocate, because I know how to work the system. Now that order is still sitting in my email. I have not needed to use it. But my point is, I had to pay $20 for that visit. I had to have a debit or credit card to, when I went on the app to book that appointment, to put it in, all of those things. Not everybody has access to that technology. Not everybody has a smartphone. Not everybody has a bank account. So as I was doing those things for myself, I was intimately aware of the fact that I have many individuals in my community who are not able to do that. All right. So with all of that in mind, I can't just leave you all with that, right? I need to leave you with some solutions. So what I need you to know, if you are a person of color, listen up. Please share this video with your family, with your friends. If you're not a person of color, thank you for listening. Thank you for watching. Please, if you're in the healthcare industry, share this information with your colleagues, because all of us have bias. Please don't tell me that you don't see color, because it's a lie. And if you do say that, if you do think that's true, you are part of the problem. We all, even African American healthcare providers, in studies, it has been demonstrated that we have bias against our own people. So please don't sit here and tell me that you don't have bias. There is explicit bias. That's what, people that are just openly racist or openly don't like Black people, Latino people. But then there is implicit bias. That is that subconscious bias that is put in all of our minds by the images that we see on television and in movies, and the things that maybe people have told us throughout our lifetime that impact how we see people who are different from ourselves. One more thing that I need to say before I give you all some solutions is going back to this coronavirus, and my biggest fear is that you all have heard, you've heard in California, you've heard in New York, is when they get overwhelmed with the number of cases, what are they talking about? What's going to happen if and when we get to a point where the number of people who need care outweighs the care, the resources that we have? That is called rationing. And I can tell you, as someone who I'm not on the front lines anymore, but I am deeply connected to individuals in the healthcare system, both clinicians, nurses, doctors, and people that are way up in that C-suite. And I am telling you all, they are having conversations with their ethics board. They are having conversations with risk management, which is what we call the legal team in the healthcare system, about policies that will direct how they ration care. Meaning, if there are 2 individuals who need to be put on a ventilator and you have 1 ventilator, they are behind the scenes, you all, having meetings, figuring out who's going to get that last ventilator. Now, in a country like the U.S., where we've already talked about all of the biases, we've already talked about the disparate health care, what do you think is going to happen? Do you think that it's really going to be objective? How are we going to make these decisions? Whose life is going to be valued? What are we going to look at? Are we going to look at contributions to society? Does that mean that the 20-year-old Black man who's unemployed or who may have a criminal record, does that mean that his life is not going to be deemed as important as the 30-year-old white woman who's gainfully employed and has 2 young children and a husband? How are we going to make these decisions? And are they going to be fair? They are not going to be fair. Individuals of color are going to get the short end of the stick. There is absolutely no question in my mind about that. So we have talked about testing. We have talked about if and when care needs to be rationed. We've talked about therapy. So what can you do about it? You have got to advocate for yourself and for your loved ones. What do I mean when I say advocate? It starts with education. It starts with education. And when I work with my clients, I talk about the GPS system. When I speak on stages, I talk about the GPS system. You all know I'm the GPS Doc. Your GPS Doc is the name of my company. And so when we talk about GPS, these are 3 things that you need to do to advocate for yourself. So when it comes to this coronavirus pandemic, particularly if you are a person of color. The G stands for gathering information. Guys, you have to be knowledgeable. Go to the CDC website, go to the WHO website, watch the daily briefings, but begin to familiarize yourself with the signs and symptoms of coronavirus. But not only that, when you need to seek care, familiarize yourself with the treatments that they are talking about. Know the names of the medications, okay? There's antibiotics like azithromycin. There are also antiviral medications, medications that target interleukins, which are things that circulate in our bloodstream that impact your body's response to infection and inflammation. I'm not going to get too technical with you all, but you need to know this information. You need to be knowledgeable. Why? Because when you go to that ER, or when your grandma or your uncle or your cousin goes to the ER and they turn them away, or they try to say, oh, this is probably just your asthma, you need to be able to say, well, doctor, I know that some of the signs of coronavirus include fever, cough, and shortness of breath, and I have those symptoms. So I think that I need to be tested. Let's say you feel like crap and they're trying to send you home. You need to know what are the criteria that warrant hospitalization. You need to say, doctor, what is my pulse ox, meaning the oxygen measurement? That's that thing that they put on your finger. You need to know your numbers. You need to ask about what is your temperature? What was your heart rate? What was your respiratory rate, which is how fast you're breathing? What is your pulse ox reading? What is that oxygen level? You need to know what's normal, okay? If your oxygen level is in the low 90s, 92, 93, and they're trying to tell you that you can go home, that's not happening. So again, if you don't have that information, you can't push back. You can't say, well, doctor, I know that 92% is not a normal oxygen level. And so I'm very concerned, and I don't think that I am stable enough to be discharged. I hate to say that you all need to know this information in 2020, but you do, okay? So again, the G is gathering information. If they decide that they're going to send you home, you need to be able to say, well, doctor, are there any treatments? Should I be on antibiotics? Should I get Plaquenil? You know, that drug that I keep hearing about on the news. You need to be able to call these things out by name, okay? So that you are not just passed over, so that you are not blown off, so that your family members are not blown off when you all present with concerns about coronavirus. If you are being sent home, you need to ask questions. Okay, doctor, you're sending me home. I've asked you about my vital signs. You've told me that those are stable. Now you need to ask, what do I need to look out for? What are the things that need to make me concerned enough to pick up the phone and call a doctor, or to turn around and come back to this emergency room? You need to have that information for yourself, for your family members. You don't just go home and say, okay, they said I wasn't sick enough, I'm home. Now what? You need to find out what are the things that you need to do in your home, because most of us who contract this virus are going to be managing it at home. So if you are doing a call, a video visit with your doctor, or if you go in person, or if you go to an urgent care or an ER and you are discharged, you need to know what are the things that you need to do at home. What are the medicines that you can take? What are things you shouldn't take? What are the vitamins that may be helpful? Why is it important for you to lay prone, which means lay on your stomach instead of on your back, which makes it easier for that fluid to build up in your lungs? There are so many things that we have learned about coronavirus and the therapies, but a lot of those things are not being talked about in these daily news conferences because they kind of go beyond the scope of that type of information. But if you or your loved one is being seen for this virus, you need to have all of the information that you can so that you can ask those intelligent questions. I'm telling you all, when you are knowledgeable, when you push back, when you ask those questions, it makes the radar go off. It piques the doctor's interest. And even if they had bias against you, they're going to be forced to kind of stop in their tracks and at least address your questions and your concerns. Okay, so that's the G, gathering information. Then the P is positioning yourself as an expert. Again, I tell all of my clients, everybody that I work with when I'm doing health advocacy, you have to position yourself as an expert. So you have to be knowledgeable about your own underlying health conditions. Please don't go to the doctor, especially now, and not have a clue as to surgeries that you had or medical problems that you have or medications that you're already taking, things that may put you at an increased risk for complications. If you go to an ER and you don't mention to them that you had heart surgery when you were 8 years old, or that you take 3 medications for high blood pressure, or that you were diagnosed with diabetes a year ago, they are not going to put you in that algorithm where they're considering you to be high risk. And so they're going to send you home. Maybe you don't need to be sent home. So you have to be the expert on your own health. You have to be the expert if you're a caregiver for your family member's health. You have to have that piece of paper or that note in your phone that lists all of the medical problems that you or your family member has, that lists the allergies, that lists the medications. You need to have access to that information at the time that you are presenting for care. You can't say, I don't know. You can't say, I take a blue pill, I take 2 white pills. Guys, this is not the time for that. Literally, lives are at risk. So that is the P. Position yourself as an expert. And the S, and I cannot stress this enough, stand up for yourself. If you are a caregiver, stand up for your loved one. I don't care how many years they went to med school. I don't care how many letters are following their name on that badge. I don't care how old they are. I don't care how distinguished they look. No one knows your health and how you feel better than you. Nobody knows your mother, your father, your grandmother, your husband, your child better than you. Okay? So if you do not feel that they are listening, if you don't feel that you are getting the care that you need, if you are not comfortable with the answers that you are being given in the midst of this coronavirus pandemic, you must speak up. Okay? You have to. You have to say, Doctor, I don't understand. Doctor, I disagree. Doctor, I'm concerned. Doctor, please explain this again. You have to speak up. This is not the time to be docile. This is not the time to defer to somebody because you think they have more information than you, because you think they're smarter than you. This is not the time. Please, you have to speak up. If you think something's wrong, chances are something is wrong. Trust your gut. Push back if you need to. Be polite, but be persistent. I'm telling you now, if you do these 3 things, it will potentially save your life and the life of your family members. All right? So I'm getting emotional right now because this is so important. So again, let's quickly go through the GPS system, how you can effectively advocate for yourself and your loved ones during this coronavirus pandemic, particularly if you are a person of color, because we have already talked about all the reasons why you may be ignored, why you may be cast aside, why you may not receive the care that you need and deserve. G, gather information. Coronavirus, guys, there's tons of information available. P, position yourself as an expert. Make sure that you are intimately familiar with your own health challenges, with the health challenges of your kids, your spouse, any other family members for whom you are responsible. And the S is to stand up for yourself, stand up for your loved ones. Push back, ask questions again. Ask why you're not getting a particular care. Ask why this particular thing isn't necessary. Ask, are you sure that it's okay if I go home? This is incredibly important. As I see these statistics, as I see how African Americans are dying at 10, 15, 20 times the rate that they should, based on how they represent the population of these cities, I had to address this tonight. So if you found this information helpful, please like this video. Please, please, please share this video with everybody in your circle. Share it on your personal pages, share it on your business pages. copy the link, email it to people, text it to people. I don't care what you do. I just want this information to be readily available. All right, so again, I'm Dr. Nicole Rochester. I am a board-certified pediatrician, a former caregiver to my late father, an independent health advocate, and the CEO of Your GPS Doc, LLC. I help family caregivers do three things: relieve overwhelm, reclaim their time, and ensure that their family members receive appropriate and effective health care. In this venue, in Navigator Nuggets, I speak to everybody: patients, healthcare providers, family caregivers, because my mission is to make sure that all of you have the information that you need so that you can effectively navigate this ridiculously complicated healthcare system, particularly now during this crisis. I hope this information has been helpful. So feel free to drop your comments and your questions below, and I will see you again next Monday night, 8 p.m. Eastern Standard Time, for our next episode of Navigator Nuggets. Take care and God bless, and be safe.